Yeah. So what I would like to say is, what is the first principle of medicine? It is that you should do no harm. Okay, so whatever the intervention may be, it may be a very small intervention like laser iridotomy where you think it has no harm, but then there are certain patients where definitely there is harm. I would give an example of one of my patients who was a young 30-year-old photographer. This lady came with PACS, just occludable angles, totally normal disc, normal fields. And I did PI in one eye after great persuasion at that time, and the patient developed glare and halos which made her miserable. So do not think that PI is a very harmless procedure. So Dr. Shika and Dr. Pankaj have summarized the evidence for and against, but then one should individualize and one should not have a cookie cutter approach. So one should remember that what we need is a patient centered approach rather than a disease centered approach. When we are looking at LPI in ACG or PAC or PACS, let us move from, is this particular patient eligible for a PI or not? So treat that particular patient, look at the risk in that particular patient, earn the patient's trust, and tell them about the possible side effects, though they may be small, and then decide whether you want to do a PI or not. So I would go with Dr. Shika's presentation overall. If you would like me to tell, the evidence-based approach is that you do it in patients who are at high risk and not for all patients with PACS. So, and I would like to stress that patient-centered care is what we need to do and not just a disease-centered care. Thank you, Dr.